Okay, so I'm gonna go ahead and verify that my patient has an order for an indwelling catheter. Okay, so once I've ensured that my patient has that order, I'm gonna go ahead and gather my supplies. Okay, so I'm going to make sure that my bag is intact and it is not open and that it is not expired. So I'm gonna go ahead and enter my patient's room. Knock, knock. Make sure that the table is clean. I'm going to perform hand hygiene, and then I will go ahead and provide some privacy. Okay, hello, Miss Carmel. My name is Camille. I'll be your student nurse for today. May I please confirm your name and date of birth?
My name is Candace Carmel. My date of birth is October 26, 1972.
Okay, perfect. So I see that you have been unable to void and that the nurses have had to catheterize you twice. And so your doctor has ordered me to insert a catheter inside you and to leave it in there, so ultimately this will help you urinate. And so once it's inserted, your urine will continuously drain into a drainage bag. Is right now a good time to perform this procedure?
Yep, this is a good time.
Okay, perfect. And I want to ask, are you allergic to any latex or iodine?
No.
Okay. And before I start, did you have any questions for me?
Yeah, I do. So why am I not able to urinate on my own?
So since you just got out of surgery and your anesthesia hasn't quite worn out yet, your organs are still slowly getting back into their function, and so that is why it is difficult for you to urinate on your own.
I have another question. What are the complications of inserting that?
So there's a possibility you may develop a urinary tract infection because we are inserting something inside your bladder. So there may be some bacteria, therefore causing some infection. Also, another complication is that you may have some blood in your urine due to tugging, and so in order to prevent that, we are going to securely tape your catheter onto your leg to avoid a lot of slag and irritation. And to prevent UTI, I will be performing this procedure sterilely. So all I ask for you is to remain as still as possible since it is a sterile procedure.
Okay. Will the process be painful?
No, it shouldn't be painful. You may experience some discomfort, but I will walk you through the whole process. So if you do experience any pain, please let me know.
Okay. And when can you take it out?
So it should only be in for a few days, but we will keep it in until we get the order from the doctor to have it removed.
Okay.
Do you have any other questions for me?
No, that's it.
Okay, so we're gonna go ahead and start. I'm gonna go ahead and raise my bed to waist level. And I'm going to make sure the side rails on the opposite side are up. Okay, so now I am going to perform perineal care. I am going to drop the blanket down and place my patient into a dorsal recumbent position. I'll check my patient. I will now put on some clean gloves. And so when I perform perineal care, I will use warm soap and water. I will be starting from the side, top to bottom, and then from the other side, top to bottom, and then from the middle, top to bottom. And so once I have performed perineal care, I'm going to remove my gloves. Okay. And so now I am going to set up my sterile field. I'm going to use this bag as my trash bag. I will place it right here. And so now I'm going to open this up away from the side. I'm going to adjust it 1-inch border. And now I'm going to put my sterile gloves onto the side right here. Now I will place a blue drape near my patient. The shiny side drop down onto the bed. So now I will go ahead and put on my sterile gloves. So now I can go ahead and disregard this since we won't be using it. I'm going to go ahead and remove my alcohol swabs. Let's remove that. And now I'm going to open my lubricant and go ahead and place it in the side of the box. And so now I'm going to attach my syringe. Now I'm going to remove the cover. I will bring this over to my patient. And so now I am going to clean my patient. With my non-normal pad, I'm going to open labia. I'm going to start from the side, from the labia to the anus. Correction, I was supposed to go around my sterile field. And now I'm going to clean from the side, front, top to bottom, labia to the meatus, around my sterile field. And then from the middle, top to bottom, meatus to the anus, around my sterile field. Okay, so now I can remove this. Correction, I was supposed to leave my hand on right here. And so now I'm going to lubricate this. For simulation purposes, I'm going to have my assistant lubricate this. Oh, it's okay.
I don't have the lubricant, but I'm going to pretend to spray the lubricant.
Okay. So now I'm going to insert the catheter. Ms. Carmel, go ahead and take a deep breath. Going in. Okay, so I see some urine. I'm going to go ahead and insert 2 more inches. Okay, and so now I am going to take my syringe and inflate 10 cc's. Okay, and so now I'm going to detach my syringe. And now I'm going to remove my sterile gloves. Correction, I was supposed to feel for resistance, so I'm going to go ahead and pull back, and once I meet resistance, that means that it's good. So I'm going to remove my sterile gloves. Okay, hygiene. I'm going to go ahead and put on some new gloves. going to tape your catheter onto your leg. First, I'm going to place it under your bed. I'm going to go ahead and place it under your bed. Okay, perfect. I'm gonna go ahead and grab some tape. And I'm going to tape down to your leg. Perfect. And now I'm going to just write on it, put the date and time and the initial. So now I'm gonna go ahead and throw away my trash.
Awesome.
Okay, all done, Miss Carmel. Go ahead and place you back into your position. How are you feeling?
Feeling good.
Good?
Mhm.
Hygiene. So now I'm gonna go ahead and place my bed to the lowest position. Your bed is low, the wheels are locked, and your collar is within reach. And so now I am going to report it. So, correction, I will lower the side. Now I'm going to report. So today, September 28th, on 16:35, I had inserted a 14 French Foley catheter into Candace Carmel. I had retrieved 600 milliliters of clear yellow urine with no sediment, no blood, and the patient tolerated it well.